Hi, great. Thank you. I'm so excited to be here today. Um, can you see that screen?
We can.
Perfect. Okay. So, good morning, everyone. As Rebecca stated, my name is Dawn Ritzwoller, and I'm really excited to present on a topic and speak on something that's very important to me. I will be presenting today on why radiation dose is important to patients from the perspective of an adult pediatric cancer survivor and public health professional. So, at the age of 12, I was seemingly a normal child, just trying to navigate the trials and tribulations of middle school life. I was involved in theater and sports and liked to be with my friends, and on occasion, I would attend school. But the most difficult part of my life at the time was being forced to do homework while also wanting to just go outside and play and be normal. And things started to shift for me in the early fall of seventh grade when I was experiencing some strange symptoms. This included a low grade fever, weight loss, and abdominal pain that my parents and myself and my physicians attributed to just prepubescent changes. I then started to have severe back pain and a fever that just wouldn't go away for weeks on end. And it was my primary care provider who I went to try to get to the bottom of it. And they diagnosed me with gas pain after giving me an x ray. They gave me medication to try to relieve this said gas pain and just sent me on my way. But a few days later, the pain had only increased. And it was when my parents contacted a family friend who was a physician and advised me to come into the ER for a CT scan to just check for a hot appendix. But it wasn't a hot appendix. I remember being so scared when I went into that first CT. I didn't know if it would hurt or even what the machine did. And luckily, there's no physical pain that's associated with the CT. But regardless, I looked up at the techs who were administering it, and they were dressed fully in these lead shields, which was confusing to me at the time, given I felt extremely vulnerable just dressed in a gown with a ton of strangers all around me. It was the first CT that was crucial because it was the definitive answer that we needed to diagnose these unusual symptoms as a stage 3 solid tumor cancer. From then on, everything went so quickly for me. I was rushed to the nearest children's hospital, and although I didn't see the physical tumor on that CT scan, I knew from that point on my life would never be the same. I would have done anything to just be normal and have this mysterious pain go away. So I had to undergo a extremely invasive large surgery to remove this tumor. And after that, 4 rounds of chemotherapy treatment over the course of a 6-month period. Although I remember parts of treatment, I don't remember too much. And the thing that stuck with me the most and felt the most stressful throughout my cancer journey and brought back these residual anxious feelings was when I had to return to the hospital and receive those follow-up CT scans. It brought me back to that very first night where one image did change the course of my life forever. So, but flash forward now, I am 12 years off treatment, 24 years old, and finally considered a cancer-free, normal adult. As Rebecca stated, I'm currently a second year child and maternal health master's in public health candidate at the Gilling School of Global Public Health at the University of North Carolina in Chapel Hill. And before that, I received a bachelor's degree in both psychology and biology from the University of Colorado Boulder, which is my hometown. And currently, I am a graduate research assistant at the Lineberger Comprehensive Cancer Center at UNC. And much of my passion to participate in research that's targeted towards quality of cancer care and cancer advocacy stems from my own experience as a cancer patient and survivor. And my mission is to be a voice for the cancer community and to empower others as they navigate their diagnosis. I collaborate with patients and healthcare teams to prioritize that patient-centered solution so everyone is treated with respect and fairness throughout their healthcare journey. I underwent a multitude of CT scans during my diagnosis, staging, and surveillance phases. And the follow-up CTs, as I said, were the most the most stressful episode of care for me. I would dread going to the hospital, always thinking that the scans maybe would pick up a tumor. And it was just extremely psychologically and emotionally draining. Every time I thought I was in the future and cancer was in my past, being back in that CT scan would bring me back to that vulnerable part of my life. And the frustrating part for both me and my parents was that no healthcare provider ever explained to me personally what the CT was, how it worked, or the amount of radiation I was being exposed to. My mother, who's a healthcare professional herself, did do research on her own, and she shared Dr. Rebecca Smith Beinman's research with my team of oncologists. And this luckily prompted the transition from follow-up CTs to ultrasounds and blood biomarkers as well. But I'm going to share a video from when I was 16 years old that my mom and I made. And this was made when I was 3 years off treatment. My mom and I explained in the video a direct example of where I felt providers had failed to give me adequate quality care and didn't put me first before unnecessary and an invasive and a potentially long-term harmful scan.
I was only 12 or 13 when I got diagnosed with cancer.
I basically insisted that she had a CT so that we could figure out what was going on. And it did provide the definitive diagnosis that probably no other kind of imaging would have. So we were very glad we had the opportunity to get that diagnostic test done. When they told us she was disease-free, that was quite a relief. They told us that there would be a step-down surveillance plan where she would start out with 1 CT per month, and then it staggered to 3 months for a year, I think. And then it was supposed to go to every 6 months. We had gone from being so anxious about her disease state, had we really gotten rid of all the cancer, that yes, we wanted the proof of that, to all of this follow-up.
The CT itself is very, very unpleasant. Everyone around me would know that it was a tough time for me. I would tell my teachers, my friends would be there for support. And a night before I would cry and I would get really, really nervous. I would shake.
Dawn would have to drink 2 liters of contrast. She had to get an IV started. She hated IVs. She hated needles.
Just the machine itself was pretty scary to me.
All of this follow-up was not only anxiety provoking for our whole family, but then it hit my radar screen much higher, with much more intensity, that the radiation exposure associated with all of these CTs, abdominal, pelvis, etc., they were adding up. It was really starting to bother me. I spoke with her attending physician about the follow-up surveillance scans. What was the benefit versus the risk of the additional radiation exposure, and what was the data? What was the evidence about the use of this? And initially, I heard pretty much this is standard protocol. He didn't have a convincing argument that this was absolutely necessary to pick up a relapse or a recurrence any faster or sooner than other kinds of monitoring or tests or other kinds of imaging with lower radiation.
We switched over, I think last year, to ultrasounds instead of CTs. And it's not scary, it doesn't hurt. And also there's no radiation, which is really good because I don't want any residual effects.
The advice I would give other families, I would suggest to them that they make sure they discuss this at length with their physician and press about, can they do low-dose CT protocols, given that this is a child, not a full-grown adult. I would be my child's advocate in a way where I would ask more questions about the need for additional CTs and scans. There's a difference between something that's indicated, you need to look in to see if something's going on, versus just having the additional scans to make everybody feel better.
If I don't have to go through it and the doctors really don't think it's necessary, then I don't really think I should. If there's an alternative to find out the same exact thing.
If there's alternatives, like an ultrasound, like other exams. Ask about it. Press why not. Press the question, why not? You don't want your child to be exposed to more CTs, more imaging than they need to.
All right, so that video, I hope, shed some light on providers ordering scans that I didn't need and just exposing me to radiation that cumulatively was increasing my risk for developing, say, another cancer down the line. So this experience was distressing, given that as a patient, we rely on healthcare providers for guidance, expertise, and compassionate care. Experiences like this can affect a patient's willingness to follow up treatment and perpetuates a distrust, and treatment and surveillance recommendations from providers. So, as I stated, a diagnostic CT performed in the emergency room did play a pivotal role in my cancer diagnosis. But that wasn't the last CT that I had. I underwent a series of imaging tests, including monthly abdominal and pelvis CTs for 3 months post-treatment, quarterly abdominal and pelvis CTs for 1 year post-treatment, and then biannual abdominal and pelvis CTs until that 5-year post-treatment line. So throughout this process, none of my doctors discussed that cumulative radiation dose with my parents or me. In fact, they didn't even speak on the CT dose protocols at all or communicate how much radiation I was experiencing through these scans. Let's think about the various phases of care when CT imaging plays a significant role. The need for radiation dose monitoring becomes essential during the phases of diagnosis, treatment and cancer progression, monitoring, and radiotherapy, as well as surveillance. But I'll be focusing specifically on diagnosis and surveillance, given that they were most applicable to my cancer journey. It's important to acknowledge that fine line between the need to rule out a potential condition and the risk of missing that definitive and actionable diagnosis. For example, prior to that CT in the emergency room, I saw half a dozen providers over a course of a 6-month period before I got diagnosed. Early signs and symptoms were dismissed, so a CT was necessary. My parents and I were frustrated with my medical providers at the time because we were at a loss of what to do. Without a CT, I might not be alive today. So my physician stated if we would have waited any longer to get this scan done, my tumor could have ruptured and it could have left me with life-threatening complications. This is why considering a necessary scan to detect my tumor was something that I supported. But during my treatment course, my providers did multiple CTs in my brain to ensure there was no progression. And in regards to radiotherapy, this is a form of treatment that I fortunately didn't have, but it also needs to be taken into account when providers calculate that radiation dose. Understanding the risks associated with a rule-out procedure becomes important years later when I'm considered cancer-free. So despite being cancer-free, I did experience PTSD episodes, and I still do today. And it leads me to believe that common issues where I'm experiencing actual stomach aches, gas pain, or period cramps might be signals of a relapse or a secondary malignancy. I would go into the emergency room or visit my primary care provider, and they would immediately opt for a CT scan to rule out the possibility of another tumor. But surprisingly, they rarely considered alternative diagnostic methods, such as blood biomarkers or ultrasounds. When unnecessary CTs were conducted, physicians didn't explain or communicate the dosage they were giving me. So this leads me to pose a few questions. Are there other methods of diagnosing or ruling out conditions other than just high-dose CT scans? If CT scans are considered necessary for ruling out a condition, do emergency room doctors use pediatric or low-dose protocols, specifically for children like myself? Are these low-dose protocols even available nationally in emergency departments? And do healthcare providers receive adequate training to understand the risks that are associated with high radiation dose CTs? When my parents and I asked these questions, the responses from emergency room providers were always, no, we do not have low dose protocols here. So another significant barrier to achieving optimal dosage is the use of insurance pre-authorization when CT scans are out of network. It should be a standard of practice for all pre-authorization to include low-dose options, and providers should ensure it's communicated to their patients. Unfortunately, with my experience, I was led to unnecessary exposure to extra radiation doses and variation in dose when I visited my local emergency room department instead of my children's hospital, which had a low dose option. But the insurance that I was under wanted to opt to send me to the emergency room or the community hospital that didn't have those low dose options. So another crucial aspect of quality care is ongoing medical education and training for healthcare providers in the context of CT dose protocols. In my eyes, this topic seems to be rarely discussed, leading to a significant gap in knowledge and training in this area of care. I want to also elaborate on the story that my mother told in that video. 6 months post-treatment, I went to the hospital for a routine surveillance CT scan. And as I've stated, I was not excited to go do this. I had to miss school. I was, like I said, I was shaking prior to these visits. I would be worried that, are they going to find another tumor? I didn't feel any symptoms, but I would psych myself out. It was that PTSD. And so I finished drinking the 2 quarts of contrast and was lying in the CT scanner when my mother overheard the technician say that I was receiving a chest, abdomen, and pelvic CT. This was an incorrect call because the chest CT should have never been ordered. My mother asked them to not do the chest CT, and a tech showed concern and started to make phone calls. They came out and stated that we could not cancel the chest CT without canceling all of it because they would need to order new pre-authorizations. So our only alternative was to reschedule the CT for another 2 weeks. This would mean I would have to miss school again, travel to the hospital, which was not in my hometown, and redo all of the IVs and drink that god-awful contrast. My parents became visibly upset, and I started crying from the stress because I was a child. I was only like 13 years old, so I didn't understand what was going on. And my mother just finally threw up her hands and said, "Go ahead, just do it, get it over with already." I remember as a child, I never fully understood what was going on. So it felt like we were fighting a battle against the healthcare professionals on the overuse of radiation exposure. This is an example of where pre-authorization barriers can cause excessive dose exposure. A few months later, my parents and I received a notification from my insurance company that they wanted to conduct CT surveillance, not at the pediatric hospital anymore, but at our local in-network community hospital. When my mother asked whether the hospital had pediatric protocols, they said no, and that they would be doing the CT at a higher dose. I was getting quite a few CTs done at the time. So that would be cumulatively being exposed to this higher dose radiation. And it took my mother multiple calls and additional communication to get this transfer stopped. This short story should shed light on the message that all hospitals should have dose requirements, and there needs to be transparency on the availability of low dose protocols. Most parents don't have a mother as a parent like I do, who isn't, there's no lack of education and understanding. So therefore, most patients, if they're in my position, would have even more radiation exposure than what I received. Because of the research that my mom did, I was able to fully switch over to ultrasounds and blood biomarkers for my yearly follow-up visits. She communicated with my doctors and pushed them hard to look into other alternatives. I was too young to advocate for myself or understand what cumulative radiation dose exposure can do. So it was my parent who advocated for me and shared concerns, not my providers. Patient-provider communication and transparency is absolutely critical throughout all phases of care. My healthcare providers failed to communicate the significant long-term health risks from the CTs I received. If I'm being honest, until I even made this presentation, I didn't fully understand the cumulative radiation that I was receiving. This lack of communication left my family and I in the dark about the potential consequences, and it hinders our ability to make informed decisions about my own health. Clear communication between patients and healthcare providers is it just has to be a norm. It enhances that shared decision making, and it allows them to work together to determine the best course of action based on patient values, preferences, and up-to-date medical evidence. It's just not only about the medical expertise, but it's also about respecting a patient's autonomy. As I stated, not every patient is as lucky as I am to have the support that I had and to have knowledgeable, self-informed support system. So this is why patients must be informed of what a CT scan is. It should be explained. What are the doses of a CT? What's a low dose versus a high dose? What radiation is involved with the CT? And what are the potential risks when being exposed to cumulative CTs? They also need to communicate the barriers to implementing successful low dose protocols in hospitals. Caregivers and patients should be aware of the healthcare facility they go to and if it offers these low dose protocols. If providers do not know how to communicate radiation exposure and dosage, then they should not be administering them in the first place. The patient and family needs to know the risk benefits, and there needs to be clear evidence or not that surveillance scans are needed. Providers should always consider alternatives, such as those ultrasounds, MRIs, and blood biomarkers. I don't believe I've had a CT scan since I was a teenager, and I feel extremely thankful for that. My call to action is this. Excessive use of inappropriate CT scans in kids and young adults just needs to stop. Every hospital should be required to adhere to regulations that mandate the reporting of CT doses for every scan and provide this information to CMS, the National Quality Forum, or other relevant authorities nationally. This would not only enhance patient safety, but also contribute to that informed decision-making in healthcare. Most patients may assume these scans only come with benefits because in my eyes, it's what diagnosed my cancer. But the truth is they're not understanding the full picture. So they need to be aware of these cumulative risks and have these things explained in a way that they can understand. I know when I was doing research and when I have been informed about this in the past, I've had to use sources that didn't use hard to follow medical jargon. So maybe there should be trainings on how to effectively communicate what exactly is going on and what CTs are in layman's terms. So if you're going to order a CT, just be prepared to explain what and why are they getting it and the long-term risks for the patients. These risks of radiation exposure, like other speakers have stated, are not trivial, especially not to the patients. And this issue needs to be front and center when you explain to the patients why they need these tests. Hospital level dosage reporting enables patients and providers to make these crucial life-saving decisions together. Thank you all for your time and attention today, and I hope that I was able to explain the perspective of how patients and survivors feel towards long-term radiation exposure.
Dawn, thank you. That was an incredibly illuminating talk. And I know that all of our participants will have appreciated the opportunity to hear from you. I think you make a compelling case about why the topics we talk about so much, justification, optimization, but don't really do very well, are unacceptable in current practice. And so I think for me to hear you state so beautifully that yes, radiation from CT scanning was absolutely crucial to your correct diagnosis and probably survival, but that also you were exposed to so many CTs that perhaps were not really necessary. And the fact that you shifted to ultrasound was just really a great move. I want to just make one other point before going to the questions, which is that we want to make sure in the work that we do that we don't let the perfect be the enemy of the good. And the fact that you were not able to get a relatively low dose protocol that's tailored to children anywhere you needed to go is a real failing of our healthcare system. And I think those doses would ideally be based on an exact size of the patient, but it's not easy to measure that, but it's very easy to measure based on age. And so if we could all standardize based on age, that would be an incredible improvement. And so we should adopt measures that help us optimize, even if they're not perfect. And I think your example with basically saying that wasn't available at a hospital really makes that point so beautifully. So I'm going to read two questions. The first, thank you for sharing your incredible journey and congratulations on being cancer free. From a patient perspective, do you feel informed consent should be a prudent and ethical medical practice for medical imaging? Can others comment if informed consent is routine at their medical imaging departments? It is not at my hospital.
Yeah, I think it's crucial with every aspect of care. They should be informed consent. And I feel as if it gets brushed over because there's a big focus on wanting to make sure that the patient's physical health is okay. But a part of that should be having them understand what's going on because a lot of cases patients don't. And there's knowledge gaps, right? So as my family and I always state, cancer is like a lottery. It can happen to anyone. And so there's a large array of individuals who come in, not to mention language barriers. So I think that informed consent should be in every part, including imaging. But I would also love to hear if it's happening at other medical facilities.
I don't think it's easy, but I wonder if the participants can type into the chat, do they do informed consent at your institution for any part of medical imaging? We can sort of see what the bulk of responses are. The next question is, can you please tell us more about the research you're doing now?
Yeah, absolutely. So I have, given that I was 13 years old, around 12 or 13 when I had my own cancer journey, I'm very focused on this adolescent and young adult age range. Just because I feel like it's this weird part of your life where you're not a child and there's a lot of pediatric support and focus, and you're also not an older adult, which also has a lot of focus in terms of quality cancer care. We're also at this part of our lives where we're starting out, getting our own jobs, finding our own way, trying to gain our own independence. So there could be a lack of healthcare, for example. Maybe we're dependent on our parents' healthcare insurance, like I am. When you reach that, mid 20s, you get off of that insurance, and it can be a scary time to try to understand and navigate a cancer diagnosis. So, right now, I'm working on a team that's tailored towards AYA. It's an AYA cancer program at the Lineberger Comprehensive Cancer Center. And I'm really focused on looking at the whole well-rounded view of patients' needs and survivors, because as a survivor, I do believe, speaking firsthand and for other survivors as well, that there's a less than optimal focus on how we're doing and follow-up care, adherence to care, and not only on our physical health, but also our mental health. Like I stated, I had PTSD episodes when I would have to go back in for scans. That's not normal. It's not normal to have these like panic attacks that I would get. So I'm really focused on what are the needs that physicians and cancer teams are missing, specifically in these AYA populations.
Dawn, I'm not sure your experience of feeling a sense of panic from imaging is so atypical. Um, that, that concern in a family member of mine is what led me to this area of research, which is there's so much invested in the CT scan in terms of does it tell me if I'm free of cancer or have cancer back is an awful lot of emotional energy that we ascribe to the CT scan that makes sense. Our fear of cancer coming back is real fear for I don't know all cancer survivors, and that's projected onto the CT scan. I think in your case, you have been fortunate to get completely clear bill of health. I think there are a lot of patients who essentially have a clear bill of health, but there's some little thing seen on the CT scan that really doesn't mean anything,
Right.
but we're not 100% sure, and sort of becomes another source of anxiety. So I think we need a whole lot more data about how to image cancer survivors to ensure that we find anything early, but that we don't create unnecessary anxiety producing interactions with the healthcare system. I mean, I think most doctors kind of stay out of the hospital as much as they can, understanding that it's not an easy place to be. All right, there are two other questions. The first is not really a question, it's a comment. It says, thanks and praise God that you've been cancer-free for 12 years. I think everyone in the audience feels that way as well. And then the last comment, how did your mother finally convince a healthcare provider to perform ultrasound instead of CT? Many physicians automatically order CT scans, regardless of patient age, symptoms, etc. And most emergency room physicians only weigh benefit versus risk when deciding what exams to order via CT. Unfortunately, physicians do not know radiation physics, as I and other licensed registered radiology technologists study as a required course of study in the 2-year program. Also, radiation biology courses are offered as mandatory in the programs. So how did your mother manage to shift the surveillance with ultrasound?
Yeah, that's a funny question actually, because if you know my mother, then you'll know that she is a natural born advocate for things that she believes in. And she will push so hard until she gets what she wants when she believes that deeply about it. And I know my mother is here, so she can probably hear me speaking on this, but she just would not let up. She would bring them literature, and she always backs things up with evidence. She wouldn't just say, I've read here and here, she would bring in the articles, she would show them the evidence, she would circle the things that would need to be focused on, and demonstrate it to them as much as she could that this was what I needed to be switched over to ultrasounds. So the way that she convinced people was through pushing and not letting up. She did not give up. She has the spine here. That's why, you know, I am extremely, extremely lucky to be the patient that had a mom as with as much passion to ensure the best optimal care for her child. And I'm not saying that caregivers don't care, they just don't know. They don't know how to go about it, and they're not aware of it. Right. So the reason that she became aware of it was through her own research and through her own investigation. And she didn't let up. She got on their case, probably way too much. It was always a norm that she annoyed the physicians beyond compare, like, and the nurses. But so she just never gave up in advocating for me.
Um, Dawn, several things you said, I just want to emphasize that are really right on the mark. The first is that indeed there've been a number of surveys of physicians who actually do these exams or physicians who order these exams, and they don't know very much about radiation. Many of them say they want to, but it's surprising that they can't even identify exams that use ionizing radiation, let alone quantifying the dose. So we need to do better.
Mhm.
Second, patients have to be their own advocates. That's incredibly important. I agree with you that not everyone can have sort of an advocate as strong as your mother, but everyone needs to advocate. But at the same time, we should not, as physicians, as technologists, as medical physicists who are responsible for setting up the way these scans are done, require patients to be such strong advocates. We should make sure that we use the lowest dose possible for every patient we scan. We need to justify the study we're doing. It needs to be necessary, and it needs to be necessary as studied in a meaningful trial, like a randomized trial, not just, hey, let's scan every 3 months, but rather we've studied this, so we need to justify it. We need to justify every phase. We need to say it's a single phase. We're not going to use more than that. And so we need to make sure that we are doing the best we can so that the advocacy that patients need to push for does not have to focus on making sure that the CT we're doing is as safe and optimized as possible.
Exactly.
Um, I think you mentioned the CMS quality measure in your comments, which I am grateful for. I've mentioned it once or twice, but basically we have a quality measure. It's been adopted into the program that hospitals can use to report their quality. It's currently open for comment in the physician program that you mentioned. Carly Stewart, our program manager who moderated yesterday, has written the instructions in the chat. Anyone who wants to write a comment, we would be grateful. The comment just has to say, I support the measure. And the measure basically just says, let's measure the doses that we're using. Um, Fantastic. There's another comment. Congratulations on your remission. What a journey that you have gone through. And then looking at the few people who have put their comments about whether informed consent is used are the gamut from no to yes and everything in between, meaning some studies we do. So I think that's really an area that we can do a little better. I think the challenge is what Amy mentioned in her talk before yours, is how much information is the right amount of information. And I wonder if you have any insights to share. So if you were provided with informed consent, knowing what you know now, what would that information look like that you would find most helpful in a conformed consent document? For example, for getting that chest, abdomen, pelvis CT or an abdomen pelvis CT.
Yeah. I think that with informed consent, it should be presented in a way for all patients to be able to understand. So it needs to be pretty simple and basic and just state the facts of why it's necessary or why it's not necessary. And then what are the risks associated with, imaging. So if they are obtaining all like the chest, pelvic, abdomen CTs, why do they need those? There needs to be clear evidence as to why they need them and why it's imperative that they receive those. So it also needs to describe how a CT works and what's low dose versus high dose. Why is dose even involved? Why is radiation involved? It needs to almost be like an infographic or fact sheet for patients to just try to grasp in layman's terms in a way that can be understood. Because I know I was reading research on it and it was like, what are these words? There's even as a person who's getting their master's in public health, I'm thrown research papers amongst every single day. And I think that people can get lost in the verbiage. So there needs to just be simple explanations of why they need a CT and what it does and why they need to receive a low dose versus a high dose, or even what the dose they would be receiving is. And I think there should be information about insurance and authorizations. So at this point, if I were to just go into my community hospital, odds are I'd receive a high dose of radiation, a higher dose than if I were, say, still being treated in a children's hospital. I think patients need to know why and what that means.
Yeah, I think that's super important. And your guess that you would get a higher dose in your community hospital than a pediatric hospital is correct. You would. And I think that's not acceptable. Okay, the last question is thank you for kindly sharing your journey and concerns, Dawn. If it's all right, may I please ask how post-traumatic stress disorder aggravated during sleep in relation to radiation exposures such as nightmares? Were there any specific fears that you regard as irrational now? Thanks once again for sharing your experience with us. God bless.
Yeah, of course. Um, in terms of nightmares, absolutely. In the weeks, even the weeks before I'd have to go get a scan, because my PTSD didn't stem from the fact, like at the time, I didn't know about really the radiation exposure. I don't think for me that's what I was focused on. But at the time, it stemmed from the fact that I associated the CT with picking up that I had a cancer diagnosis. So it's kind of like being, living your everyday life, being delusional, like, oh, if I don't see it, it's not there. But then when you go in for a CT, it's actually, you're seeing it. You're getting a full body scan to see it. And it would always scare me that maybe I just had a tumor that was undetected, and I didn't have symptoms at the time. And then if I went in, it would get picked up. So all the time I was scared to get CTs. And this was not only in just a couple years post treatment. I think if I had to get a CT scan tomorrow, I would be nervous, being concerned that something would get picked up. So I associate a cancer diagnosis and just having to go through the trauma of losing my hair and all steps of chemotherapy with that initial CT scan. It just all comes back to that. And I truly remember it just so vividly. They put like little stickers, like princess stickers in the CT scans at Children's Hospital, and they make it warm and like more inviting. And then in these community hospitals, it's like technicians dressed head to toe in these garments that are to make ensure that they don't get radiation exposure. But what about the patients who are just there in a vulnerable state? So, yeah, even to this day, CT scans give me a lot of anxiety, I would say.
And I think that's part of our responsibilities as the providing doctor. We can't just say that that's not really our problem, that patients have fear of their cancer recurring attached to the CT scan. That makes sense. And sort of just elevating that fear so often with more scanning seems unfair. All right, I said we were going to be done, but there are several more questions that I think it'd be great for you to answer because you do have time. And I'm pretty sure, please confirm that you are thinking about getting involved as part of your work in advocacy.
Absolutely. I want my career to be based off of patient advocacy. Although I'm in public health and I do like the research side of things, because I think it's absolutely necessary to develop implementation measures long term. My dream is to be just completely immersed in patient advocacy long term and be that voice for patients that maybe don't know how or don't have a full understanding on how to communicate what they're feeling. I feel as if all of my entire cancer journey is a benefit to my life long term, because the ultimate goal is to serve other patients and survivors throughout the rest of my career.
So one of our participants would love for us to share your email because their
Yeah.
department would appreciate her input on our patient and patient advocacy efforts. I would just say that that would be, I think, not a volunteer opportunity as far as I was concerned. That would be a paid opportunity, I hope. But if you
Yeah.
give us permission, we will share your email for sure.
Please do. I would love to be involved in any way that's needed.
Fantastic. So there are two more questions from the next one. Thank you for sharing your journey. Thank God for your being in remission. My question is, who do you feel should give our patients this information on radiation exposure and risk? The ordering doctor or radiology staff? It's a lot of information to give the patient right before the exam.
Right. I mean, ultimately, I always advocate to have social workers involved or psychologists involved in a cancer team. But if, let's say, the funding is not, available to hire such a person or a team, I would say that there should be necessary trainings from the physician to give this information. If a physician doesn't know how to communicate it, give them the training to be able to learn how to communicate it. I think in general, there should be more trainings in healthcare to teach physicians how to optimally communicate with patients. That's a key part of it.
I agree with you. This is part of the work we need to be doing if we're doing these tests. Okay, now the last question from a technologist. As a technologist, I've experienced patients, adults and peds, who are not informed as to why they are there or what the radiation dose means or if it's necessary. I often wonder why the clinician had not had this discussion with them before their arrival at the CT suite. Her interest in patient advocacy is on point. Why is informed consent not a requirement? I think we'll leave that as a comment because you've told us already that you think informed consent is really important.
Yeah.
There are several other comments in the Q&A that basically are just reiterating our appreciation for your sharing your story and doing so eloquently. Um, thank you. We have earned a 10-minute break. So we're going to break for 10 minutes and then reconvene. And my time, it's at 9:40, but it's basically 11 minutes from now. Dawn, thanks again for sharing your story, and we'll see everyone back in 10 minutes. Thank you.
Thank you, Rebecca.